Good morning, I am Valimir Basul and I am going to demonstrate to you the preparing and administering oral medications. Oral administration is the easiest and most desirable way to administer medications by mouth. To provide a medication that has systemic or local effects on the gastrointestinal tract or both. We have to assess for the allergies, the medications, the client's ability to swallow the medication, presence of vomiting and diarrhea that would interfere the medication to absorb the medication, specific drug action, side effects, interactions and adverse reactions, the client's knowledge and learning needs about medication, perform appropriate assessments specific to the medication, and of course determine if the assessment influences the administration of the medication. In planning for administering oral medication we should aware the patient. Second is organize the supplies and equipments like the medicine tray, medicine cups or gauze, paper tissue, mortar and pestle, medication dropper or syringe, glass of water, and straw as necessary. And then the medication card. And we have to observe the correct time, and we call the guiding principles, and of course obtain the appropriate medication. The first procedure in the preparation of oral medication is we have to gather the equipment. It is to prevent overreaching. And then check each medication order against the original physician's order according to agency policy. This helps to identify the errors that may have occurred when orders when transcribed. Next is check the patient's chart for allergies to avoid allergy reactions, and then know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse reactions of the medication to be administered. And this knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Next is we are going to perform hand hygiene. It prevents spread of microorganisms, and then we are going to obtain and prepare the appropriate medication for one patient at a time. This prevents error in medication administration. Next is when to prepare the required medicine is we have to get the pill, the tablet, and then the capsule, the package unit dose. We are firstly going to place directly into the medicine cup and do not open the wrapper until at the bedside. And the wrapper is kept intact because the label is needed for additional safety check. When we are going to use the multi-dose containers or the stock container, firstly is we are going to pour necessary or required number into the bottle cup, and then transfer the medication into the cup, allows for easy return access medication to the bottle. Next is we are going to transfer the medication to the medicine cup without touching the medicine. We're just going to pour it with pouring the tablet or the capsule in the hand is unsanitary. So we're just going to do this. Next is if we are going to use the liquid medication is we are going to thoroughly mix the medication before pouring. Remove the cup and then place upside down. Hold the bottle so the label is next to your palm and pour the medication away from the label. And the liquid that may drip to the label, next the label too difficult to read. Next is we are going to place the medicine cup at our level and fill it to the desired level, using the bottom of the meniscus to align with the container scale. It is to see the label carefully, and of course, before the cup of the bottle, wipe the lip with a paper towel to keep the cup clean. Next is we are going to place the prepared medication and medication ticket on the medicine tray. Bring medication to the patient's bedside carefully and keep the medication inside at all times. This prevents accidental or deliberate disarrangement of medications. Next is we are going to ensure that the patient receives the medication at the correct time. It is to track the facility policy, which may allow for administration within a period of 30 minutes before or after the designated time. When we are going to administering oral medication is we are going to prepare the client. Ask the patient to state his or her name, identify the patient, ensures the right patient receives the medication, and help provide. And then we are going to check the name, of course. If the patient can identify or resource, verify the patient's identification with the staff member who knows the patient for the second source. Next is we are going to complete unnecessary assessment before administering medications. This assessment is prerequisite to administration of medication. Next is we are going to explain the purpose and action of the medication to the patient using a language that the client can understand. Include the relevant information about the effects. It is to educate the patients about his or her medications.
Ate Guyang na iba nabalik sila sa kuan sila sa past kibali gani naka kuan sila katong naglandag na munang marine sa dagat nakasulod sila sa time pa ng mga dinosaur ba mga dagko ng mga kuan nakasulod sila doon na isla dinosaur na.
If an older child or adult has difficulty swallowing, ask the client to place the medication on the back of the tank before taking the water. If the medication has an objectionable taste, ask the client to suck some ice chips beforehand or give the medication with juice if there are no contraindications. Liquid facilitates swallowing of tract. Next is we are going to remain with the patient until each medication is swallowed. Never leave the medication at the patient's bedside unless you have seen the patient swallow the drug. The drug cannot be recorded as administered. Next is we are going to document each medication event. Documentation helps ensure the patient's safety and then dispose all supplies appropriately. It should be put in the appropriate receptacles. And of course, evaluate the effects of the medication that the patient needs to be evaluated for therapeutic and adverse effects for the medication. So that's all for the preparing and administering oral medications. Thank you and see you soon.